My name is Pechtel. I'm a psychologist. I registered in the UK and recently moved to Canada. And I'm really excited to host this workshop. The key underlying question of this workshop is really how neuroscience on the impact of trauma on brain development translates into frontline clinical practice. And that's really something that has been guiding my own research, but also my clinical work over the past 2 decades. And I think for that, I was really thinking about how can we make this translation piece happening in a workshop. And for that, sort of decided on 2 aims. So first of all, to think about guiding principle to extract those from the last 20 years of neuroscience research and how it impacts brain development. And use these guiding principles to understand what is it about the experience of trauma that helps us understand how the brain is developing structurally and functionally. And for that, it's like the age of when it happens, the type of trauma that people are experiencing. How does it help us understand the unique development that research is suggesting? And I guess these guiding principles will then allow us to do the translation piece. And that is the second aim, to see how these guiding principles apply to evidence-based practice. So those that we think work well already, like helping with post-traumatic stress disorder or depression, but also to push this further and saying, if we know these mechanisms or these guiding principles of neuroscience, how as clinicians can we then help to promote resilience? We know we are pretty good at addressing some of the sequelae of trauma, but we also know that life stresses keeps on coming, and those with a history of trauma have a different reaction. And I think boosting or promoting resilience is something that our field needs. And I think as clinicians, we are the experts. I think neuroscientists over the past 20 years have done amazing progress, but the translation bit, I would like to think together in the room to say, what are we doing already that works well, that is already maybe in line with these neuroscience principles? And what can we do thinking creatively together and saying, how can we push it further to provide better support for those clients that we serve?